Hello everyone, welcome back to Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss with multiple pregnancy. Multiple pregnancy. Here, we should know that what is multiple pregnancy. Here, a pregnancy with more than one fetus, such as twins, triplets, or quadruplets. And then here, multiple pregnancy happens when more than one baby develops in the womb, either because multiple eggs are fertilized or because a single fertilized egg splits into multiple embryos. This is the mechanism. In this class, we'll discuss what is multiple pregnancy, what are the causes, risk factors, classifications, complications, and management. Okay, we'll start. Multiple pregnancy refers to a pregnancy where two or more fetuses develops simultaneously in the uterus. At a time, growth takes place, fetus growth takes place. That is multiple pregnancy. And then here it is also known as multifetal pregnancy. And then here we can see the common types. Twins pregnancy, that is two fetuses. Here it is a most common thing it is. And then triplets pregnancy, that is 3 fetus. And then quadruplets pregnancy, that is 4 fetuses. Next we'll see the classification. It is a most important thing. Here first by zygosity, we can see by the zygosity here two types, monozygotic and then dizygotic. Okay, first we'll see the monozygotic one. Here it is an identical twins. We can see the identical twins in monozygotic. And then here what happens? Single zygote splits into two embryos. You can see in the picture there. Single zygote splits into two embryos, always same sex and genetically identical. Here the zygote splits into two embryos, that is monozygotic. Okay, and then it is an identical one. Genetically identical it is. And then comes to the second type, that is dizygotic, that is fraternal twins. Here we can see two separate egg are fertilized by two different sperm, maybe of the same or different sexes and are genetically different. You can observe here two separate ova are fertilized by two different sperms. You can see in the picture here, two different eggs are fertilized by the two sperms, and then maybe of the same or different sexes. It may be same or different, male or female, and are genetically different. Okay, here we can see. And then here it is by monozygotic identical twins here, and then it's fraternal twins. We can see in the dizygotic here. It is in the picture. I hope you all are clear. First we have discussed by zygosity. Second we are going to see by chorionicity and amnionicity. These are the layers. Okay, first one is dichorionicity, dichorionic, diamniotic. Here each fetus has its own chorion and amnion. Here you can see each fetus has its own chorion as well as amnion. Okay, amnion and chorion. Can be monozygotic or dizygotic. Yes, of course. And then here comes to the second one, monochorionic diamniotic. That is shared chorion, but separate amnion. That is always monozygotic. And comes to the third one here, that is monochorionic monoamniotic. Here it is shared chorion and amnion, both are shared here. Here it is here separate amnion we can see. Here it is both shared, amnion and chorion is shared. And then fourth one is conjoined twins. Here incomplete division of a single zygote. You can see here in the picture conjoined twins. there will be the incomplete division by the single zygote. I hope you all are clear. Next, we'll see the causes and risk factors here of multiple pregnancy. First of all, first one is maternal age. Here, advanced age, it is 30 to 40 years. And then assisted reproductive techniques, ART, for example, in vitro fertilization. And then third one is a family history. It is genetic predisposition for zygotic twins in the family. And then parity, higher chance in multiparous women. And then ethnicity, higher incidence in African population. We can see in African population. These are the causes and risk factors we can say. Okay, next we'll see the clinical features here. Here, first one is uterine size larger than gestational age. Uterine size will be larger than gestational age. And then excessive weight gain early in pregnancy. Excessive weight will be present. Weight gain will be present early in the pregnancy it is. And then hyperemesis gravidarum due to elevated beta HCG level, human chorionic gonadotrophin levels, that is elevated. And then multiple fetal heartbeats on auscultation. We can hear the multiple fetal heartbeats on auscultation, and then increased maternal discomfort. For example, dyspnea, it may be back pain. These are the clinical features of multiple pregnancy. Next, we'll see the diagnostic tests. Here, ultrasound, P.B.Bsc is important. It confirms chorionicity and also amnionicity, and the number of sacs and placentas. P.B.Bsc is important here. And then second one is a beta HCG. Here, elevated levels compared to a single pregnancy. Here, in multiple pregnancy, what happens? Beta HCG elevated level will be present compared to a single pregnancy. And then third one is a Doppler studies to assess fetal well-being and placental functions. Here, these are the diagnostic evaluations for multiple pregnancy. Next comes to the very important part of this topic, that is management. First, we'll discuss antenatal care here. In antenatal care, we can see more frequent antenatal visits has to be there. More frequent antenatal visits, and then nutritional support. For example, increased calorie and protein intake. That is nutritional support. And then supplementation with iron and folic acid. And also regular monitoring for complications. For example, complications in the sense preterm labor and then preeclampsia. This is all about the management of antenatal care. Okay, next we'll see the delivery planning. Delivery planning, here vaginal delivery. Considered for dichorionic twins. If both are cephalic, the presentation is, cephalic, that time vaginal delivery can go for vaginal delivery, that is considered for dichorionic twins. And then cesarean section recommended for monoamniotic twins, or if one twin is in a non-cephalic presentation. We'll see the third one, that is interventions for complications. Okay, here close monitoring for twin-to-twin transfusion syndrome in monochorionic pregnancies. We have to monitor for the syndrome. What is that? Twin-to-twin transfusion syndrome. And then also corticosteroids for fetal lung maturity. Fetal lung maturity if preterm delivery is anticipated. Corticosteroids has to be given for the fetal lung maturity if delivery is preterm. Next, we'll see the complications. Okay, complications of multiple pregnancy. First, we'll see the complications for maternal complications. Okay, hyperemesis gravidarum this is the most common one. And then gestational hypertension and preeclampsia We can see anemia, and then preterm labor and delivery, and then postpartum hemorrhage. These are the maternal complications. And then next we'll see the fetal complications here. Prematurity, that is most common complications in multiple pregnancy. Prematurity, and then intrauterine growth restriction, and also twin to twin transfusion syndrome in monochorionic twins, and then also congenital anomalies, that is higher in monozygotic twins. Please like, share and subscribe to my YouTube channel for more informative content. Thank you for watching.